Could your medication be the reason your blood sugar is spiraling out of control? It's a hidden risk millions of people face every day, completely unaware that common prescriptions could be silently wreaking havoc on their health. Imagine diligently managing your diet, exercising, and still seeing your glucose level spike. Sounds frustrating, right? In today's video, we'll uncover 15 medications that could secretly raise your blood sugar. Whether you're managing diabetes, prediabetes, or just aiming for better health, understanding these hidden risks could save you a lot of trouble and help you take back control of your health. Let's start with an important point. Not all medications are created equal when it comes to their impact on blood sugar. Some categories are more likely to cause spikes than others, and knowing which group your medication belongs to can help you stay ahead of any potential issues. Let's break down the 15 medications that could impact your blood sugar, explaining why they're used, how they affect blood sugar, and what you can do to minimize the risks. Number 1. Prednisone, corticosteroid. Prednisone is widely prescribed for conditions like inflammation, arthritis, and asthma. However, it raises blood sugar by increasing glucose production in the liver and reducing how sensitive your body is to insulin. This effect is particularly pronounced in individuals taking high doses or using the medication long-term. If you're prescribed prednisone, talk to your doctor about alternatives like inhaled steroids and keep a close watch on your blood sugar levels. Number 2. Statins, e.g. atorvastatin Lipitor. Statins are essential for lowering cholesterol and reducing heart disease risks, but they can also slightly raise blood sugar. This happens because statins may decrease insulin sensitivity and affect how glucose is metabolized. If you have prediabetes or a family history of diabetes, you're more likely to notice these effects. To counterbalance this, focus on eating a heart-healthy diet and incorporating regular physical activity. Number 3. Beta blockers, e.g. metoprolol, atenolol. Used for high blood pressure and heart conditions, beta blockers can interfere with your body's ability to detect low blood sugar symptoms, like sweating and shaking. Over time, they may also increase glucose levels by reducing insulin secretion. Diabetics and individuals who rely on recognizing these warning signs are especially at risk. If you're on beta blockers, prioritize regular blood sugar testing to avoid surprises. Number 4. Antipsychotics, e.g. olanzapine, risperidone. Antipsychotic medications treat serious mental health conditions like schizophrenia and bipolar disorder, but they can disrupt insulin sensitivity and lead to weight gain, which worsens blood sugar control. Long-term users and those with existing metabolic issues are most at risk. Work with your doctor to monitor these side effects, and consider lifestyle changes like balanced eating and physical activity to mitigate the impact. Number 5. Oral contraceptives, e.g. Yaz, orthotricycline. Birth control pills combine hormones like estrogen and progesterone, which can mildly elevate blood sugar by reducing glucose tolerance. While these medications are generally safe, women with COS, diabetes, or prediabetes should stay vigilant. If this applies to you, ask your doctor about low-dose options and keep track of your glucose levels regularly. Number 6. Decongestants, e.g. pseudoephedrine, Sudafed. Commonly used for nasal congestion, these medications can spike blood sugar by triggering the release of stress hormones like adrenaline. Diabetics and people using decongestants frequently are at higher risk of these side effects. To avoid this, consider non-decongestant alternatives like saline sprays or antihistamines when battling congestion. Number 7. Diuretics, e.g. hydrochlorothiazide. Prescribed to reduce fluid retention and lower blood pressure, diuretics can cause your potassium levels to drop, which interferes with insulin function and raises blood sugar. Long-term users and diabetics are most affected. To mitigate the risks, include potassium-rich foods like bananas, oranges, and spinach in your diet. Number 8. Fluoroquinolones, e.g. ciprofloxacin, levofloxacin. This class of antibiotics treats bacterial infections, but can cause erratic blood sugar fluctuations by affecting insulin production. Older adults and diabetics are particularly vulnerable to this effect. Monitor your glucose levels while on these antibiotics and inform your healthcare provider if you experience sudden changes. Number 9. Progesterone-only hormonal therapy, e.g., Depo-Provera. Hormonal treatments like Depo-Provera are effective for birth control and treating hormonal imbalances, but can lead to insulin resistance over time. Women with pre-existing blood sugar issues should approach these treatments cautiously. Discuss alternative options with your doctor and keep a close eye on your glucose levels. Number 10. Antidepressants, e.g. SSRIs like fluoxetine. Antidepressants are life-changing for mental health conditions like depression and anxiety, but some can interfere with glucose metabolism and insulin sensitivity. People with metabolic syndrome or diabetes may notice these effects more. Maintaining a healthy diet and consistent exercise routine can help manage these side effects. Number 11. Thiazide diuretics, e.g., chlorthalidone and dopamide. These diuretics are commonly prescribed for high blood pressure and to reduce fluid retention, but they can raise blood sugar by affecting how your kidneys process glucose and potassium. People with high blood pressure, diabetes, or prediabetes are most at risk. To manage the impact, work with your doctor to find the right dosage and monitor your blood sugar regularly to catch any changes early. Number 12. Antihistamines, e.g., diphenhydramine Zyrtec. Antihistamines are popular for treating allergies and cold symptoms, but some can increase blood sugar by blocking histamine, which can interfere with insulin release. If you're prone to elevated blood sugar, consider using non-sedating antihistamines like loratadine and be mindful of how your body reacts after taking these medications. Number 13. Immunosuppressants, e.g., tacrolimus cyclosporin. Medications that suppress the immune system, such as tacrolimus and cyclosporin, are often prescribed after organ transplants or to treat autoimmune diseases. These drugs can interfere with insulin secretion and cause insulin resistance, increasing the risk of high blood sugar. Long-term users, especially transplant patients, should regularly monitor their blood sugar levels and discuss alternative treatment options with their doctors. Number 14. Anti-seizure medications, e.g. phenytoin, carbamazepine. Anti-seizure medications are necessary for controlling epilepsy and other seizure disorders, but some, like phenytoin and carbamazepine, can raise blood sugar by affecting the liver's ability to process glucose and altering insulin secretion. If you have diabetes or are at risk for it, talk to your doctor about close monitoring of blood glucose levels while on these medications. Number 15. HIV medications, e.g. efavirenz atazanavir. Certain HIV medications, particularly older ones, can cause insulin resistance and raise blood sugar levels. This side effect is more common with older protease inhibitors and some non-nucleoside reverse transcriptase inhibitors, NNRTIs. If you are managing HIV and notice changes in your blood sugar, work with your healthcare provider to find alternatives and consider lifestyle modifications, such as diet and exercise, to offset the impact. Now that we've covered the medications that could be raising your blood sugar, it's essential to understand how to manage these effects effectively. Remember, the medications themselves aren't bad, but they need to be carefully monitored, especially if you have diabetes, prediabetes, or are at risk for these conditions. Here are a few practical tips to help. Communicate with your doctor. Always inform your healthcare provider about any existing conditions and medications you're taking. If you notice changes in your blood sugar, ask about possible adjustments or alternatives. Monitor your blood sugar levels. Regular testing is crucial, especially if you're on any of the medications mentioned. This can help you catch any potential spikes or drops early. Healthy lifestyle choices, a balanced diet, regular exercise, and managing stress are powerful ways to support your blood sugar control. Focus on foods that improve insulin sensitivity, like leafy greens, whole grains, and healthy fats. Stay informed. Knowledge is power. The more you understand about your medications and how they interact with your body, the better equipped you'll be to make informed decisions about your health. We've covered 15 medications that could be silently raising your blood sugar, but with the right knowledge and strategies, you can still stay on top of your health. If you're concerned about any of the medications discussed, don't hesitate to reach out to your healthcare provider to find the best plan for your needs. Your blood sugar is just one part of your overall health, and with a proactive approach, you can manage it effectively. If this video was helpful, make sure to hit that like button, subscribe for more health insights, and leave a comment if you have any questions or personal experiences to share. Your health journey matters, and we're here to support you every step of the way.